go ahead and get us started so we don't run too much over in case people are pulling away from their day jobs to join us, which I very much appreciate. My name is Matt Winter. I'm the Chief Veterinary Medical Officer for VetCT, and I really would like to welcome you to the last of our 12-minute take-home webinars. It's great to see so many people here, and I'm glad that you've taken the time to join us. VetCT recently launched our new app and teleconsulting service, and we would love for you to give it a try. That through this app, vets get instant access to a team of friendly specialists that will offer support and advice on tricky cases. And you can choose to communicate with the team of specialists via an instant callback, text chat, book an appointment at a time that suits you, or ask for a written report. And we've now made it even easier for you to interact. It's like having a specialist on speed dial. You just ring through via the app and our team will help create the case and get you in touch with the specialist that you need. And while learning on each of these cases, anyone in the UK will also get the added benefit of real-time CPD. So to try this, please download the app from the App Store or from Google Play. You can scan that QR code that's up there on the screen right now, and it'll take you directly to the app. This is beneficial for employed and locum vets alike, and we'd be happy to discuss this more with you. Just go to our website or contact sales@vetct.com for more information on this. So I want to get on to today's 12-minute webinar. As a reminder, this session is being recorded and there'll be an opportunity to ask questions at the end. So please do add any questions into the Q&A section of the webinar. We'll answer as many of them as we can as time allows and follow up with the others via email if we didn't get to answer them. And now I'd like to introduce you to the oncology team, and in particular, Dr. Kasia Purzycka, who is leader of the team and will be presenting today's talk. Kasia comes to us from via Warsaw, Poland, completing her 4th year of veterinary training in Vienna. And she did her residency at the RVC and holds her American College of Veterinary Internal Medicine board certification in oncology. She's going to be presenting today's session, Feline mast cell tumors, because cats are not small dogs, which is a clinically relevant discussion that was chosen by you from a list of popular oncology topics. So with that, I'm going to turn over to Kasia.
Thank you, Matt. Welcome everyone, and I'm really pleased you chose the topic on feline mast cell tumors. You know, we get to hear a lot about mast cell tumor in dogs, but I don't think there is enough out there on feline mast cell tumors, and we definitely get to meet them in our clinical everyday practice. It's only 12 minutes, so there will be a lot of information I'll try to share with you in a short space of time. So apologies if it's a bit quick. And cuteness alert, I'm going to you will see some photos of a little kitten I recently rescued. So very briefly on mast cells, so the cells that make our mast cell tumors, they all originate in bone marrow, and then they travel to different places in our body, mainly to the skin, respiratory tract, GI tract, where they play different roles, mainly in allergic reaction. They also play a role of kind of first line defense against parasites, against bacteria. And they can also make mast cell tumors. So perhaps they're not as common in dogs, but it's still, depending on the study, fourth most common tumor in cats in general. The clinical presentation and response to treatment is slightly different it's quite different comparing to dogs. In dogs, we see them all the time affecting the skin and subcutaneous tissues, while in cats, we do see cutaneous mast cell tumors, but we definitely also see splenic mast cell tumor, a very important clinical presentation. We also see gastrointestinal mast cell tumors, which are very uncommon in dogs. And we'll briefly discuss also disseminated mast cell tumor at the end of that talk. So when we talk about cutaneous mast cell tumor in cats, typically, we can divide them in two morphological forms. You might come across a histiocytic form, which typically affects younger cats, very often Siamese cats, These cats can have multiple nodules, mainly on the head, around pinna, and interestingly, these can actually spontaneously regress. It can take up to several months, even up to 2 years for them to regress. But I would like you to be aware of that very typical clinical presentation. On the other hand, we have the mastocytic mast cell tumors, which on cytology will just look like a classical mast cell tumors. They can be solitary or multiple. There is no clear breed predisposition, and pretty much any cat of any age or any breed can be affected with the mastocytic mast cell tumor. Most of the cutaneous mast cell tumors in cats are benign. Rarely they can actually be part of the disseminated mast cell tumors, especially when they're multiple. Then they can be part of a more systemic disease. But most of the time they're benign. How do we diagnose them? Firstly, on cytology, they're quite rewarding to diagnose. Typically you're going to see those quite cellular slides with a lot of mast cells that are typically well granulated. The histopathology will be something you might get just after surgical excision, and I have already mentioned that most of them are benign, but 1 in 5 might behave in a more aggressive manner. So they might be more prone to recur, they might be more prone to spread to other parts of the body. And things for us to watch out for in our histopathology report would be definitely whether that mast cell tumor is well differentiated or pleomorphic undifferentiated. The mitotic count of more than 5 per 10 hyperfield has been also shown to hold some prognostic value. And also, if in the report you see anything like pleomorphic nucleus, prominent nucleoli, or if clinically the mass is larger than 1.5 centimeters, these mast cell tumors can behave more aggressively. When it comes to staging, we know that this is similar to dogs. Mast cell tumors, if they metastasize, the first place to go to is a local regional lymph node. So there are 2 ways of doing that with cats. Either you take the mass out, and if in the histopathology you see any of the criteria of a concern, you then go back and do the staging. Or if you can clearly identify the sentinel lymph nodes at the time of surgery, especially if that lymph node feels enlarged, you should perform a fine needle aspirate of that lymph node as well. So treatment of choice is surgery. The vast majority, 70–80% of those will be cured with a simple surgical excision. There is no consensus on the ideal surgical margins. Probably less than what we require in dogs. And in reality, if you're dealing with a mast cell tumor on the head, on the cat's head, there's not much space to take wide margins anyway. Only few of them recur, and what I'd say is if you do deal with a high-risk mast cell tumor and your margins are incomplete, you should consider some additional local treatments, such as either revision surgery or radiation therapy. Neoadjuvant treatment, so treatment that we use to try to shrink the mass before surgical excision. There are a lot of drugs out there. Steroids are quite controversial. Certainly in dogs, there's some people who advocate for use of steroids. Please keep in mind that the shrinkage that they cause might be more related to the swelling rather than mast cell tumor itself, and the responses that we see in cats after administrations of prednisolone are certainly not as robust as we sometimes see in dogs. Lomustine is also a reasonable choice if you need to shrink the mass. About 50% of them will shrink with that treatment. So Moving forward, we have a case of 12-year-old domestic short hair who presented with intermittent vomiting and weight loss. On a physical exam, we could feel an abdominal organomegaly, possibly splenomegaly. And on CBC, we could see few circulating mast cells. And here I like to draw your attention to differentials for mastocytemia. So while we know that mastocytemia in dogs is typically is typically unrelated to mast cell tumors. Dogs with systemic inflammatory disease, such as parvovirosis, are actually more likely to have circulating mast cells than dogs with mast cell tumors. However, mastocytemia in cats, is quite rare, and if it happens, is actually quite relevant. So there was this really interesting study that reported mastocytemia in 33 cats out of a few hundred. So it's quite rare. And if you have a look, 25 out of 33 cases actually had a mast cell tumor. And those cats who didn't have mast cell tumor, 4 of them had lymphoma, 3 had CKD, and 1 had hemangiosarcoma. So again, mastocytemia in cats is rare, and if you do find it, please look for mast cell tumor. So with that case, we went to ultrasound, and we actually did confirm what we could feel in physical exam was spleen, and that the spleen had very heterogeneous parenchyma. So we stuck a needle in it, and here you can see quite an abundant population of well-granulated mast cells in it. We also did check liver. There were some mast cell tumors in liver as well. So Daisy underwent a splenectomy, after which her clinical signs resolved, and she's been doing very well for several months after. So, this splenic mast cell tumor in cats is quite a unique clinical entity. When we think about dogs, splenic mast cell tumor is most likely to be a spread of some aggressive cutaneous mast cell tumor. In cats, that's not the case. We typically see it in older cats. Typically, they're unrelated to cutaneous mast cell tumor. However, sometimes the cutaneous, especially if we have multiple cutaneous mast cell tumors, they can actually be related to the splenic mast cell tumor in the first place. And interestingly, following splenectomy, these cutaneous mast cell tumors can spontaneously regress. Any splenomegaly, splenic changes in cats, consider mast cell tumor as a differential. And like I already said, the mastocytemia should always cause that red light. Perhaps there is a splenic mast cell tumor. We might see changes in other abdominal organs. In really advanced cases, cats can present with ascites, and we diagnose it most of the time by cytology of the spleen. Treatment of choice is splenectomy, and cats after splenectomy have quite decent survival. We thought initially it was year and a half. More recent studies show the median survival time is actually 2.5 years. It is unknown whether these cats need chemotherapy after splenectomy. So, currently there are no firm recommendations. I would say if you have a heavily infiltration in other organs and that persists after splenectomy, I would consider other drugs such as lomustine. And again, if a case, for example, is not surgical for whatever reason, you can also consider palliative lomustine in these cases. And keep in mind that by the time of splenectomy, these cats should receive supportive treatment with antihistamines and some gastroprotectant. Intestinal mast cell tumors also, so the third clinical presentation in cats, quite relevant. It's third after lymphoma and carcinoma, most common intestinal tumor in cats. Again, typically older cats. most of them will have clinical signs. So there will be vomiting, diarrhea, weight loss. Depending on how advanced the case is, you might have a palpable mass on your physical examination. And on imaging, typically we see changes in the intestine, typically small intestine. There can be focal lesions. Unfortunately, quite a few cases of the intestinal mast cell tumors, you're going to have multifocal presentations, sometimes changes in other parts of the body as well. They can metastasize to abdominal lymph nodes, liver, spleen. Interestingly, lungs. Mast cell tumor in dogs almost never metastasize to lungs. In cats, this can actually happen. With the diagnostic workup, very briefly for the intestinal mast cell tumor, here as well, you will aim to obtain a fine needle aspirate with ultrasound guidance of these changes in the intestine, whether that's intestinal mass, whether they're enlarged abdominal lymph nodes. And these cytology specimens are also quite stellar. But couple of things to keep in mind in these intestinal mast cell tumors. The mast cell tumors, intestinal mast cell tumors, might not be as well differentiated as the splenic or cutaneous ones. So what you might see are just round cells, for example. The other thing is that you should also consider other differentials. If you have if you see on the cytology a population of round cells, especially with granules, think of large granular lymphoma. That's a strong one in cats. Or if you have an eosinophilic infiltrate in your cytology, the feline gastrointestinal eosinophilic sclerosing fibroplasia is also a strong differential. What do we do with these cats? Well, the treatment of choice is still a surgery, provided the lesions are localized. So we don't have a lot of studies for on intestinal mast cell tumors, and historically we thought that the prognosis was really poor. But actually these days, with more research and more and us being more proactive, doing imaging more kind of early in the disease course, we see that cats that go into surgery and get local treatment actually can survive on average year and a half after surgery. So quite decent survival. Statistically, the things that affect the prognosis will be extent of the disease. Clearly, cat that have one localized small lesion comparing to cat with multiple large intestinal infiltrates, probably the latter will do worse. Presence of metastasis, that's kind of logical. If you have a heavy infiltration of other organs, these cats will not do as well. These cats are less likely to go to surgery as well. If in your histopathology that mass is very poorly differentiated, has a lot of criteria of malignancy, these cats statistically also will have a worse outcome. There is no strong evidence regarding the location. However, in the most recent study, cats with colonic involvement potentially lived much longer. And I did have some cats with colonic mast cell tumors surviving several months on medical treatment only. There is no consensus on chemotherapy. We don't know which drugs work best for these cats. Certainly, I would say if a case is not surgical, I would consider medical treatment, again, such as lomustine. Feline mast cell tumors do have a c-KIT expression, so tyrosine kinase inhibitors such as dasatinib, Palladia, is a very reasonable consideration. And obviously remembering as well the supportive treatment. Remember, these cats are weak. They have a lot of GI signs. And last clinical presentation is this disseminated mast cell tumor, such as this cat who presented with vomiting, weight loss. On a physical exam, this cat had a large submandibular lymph node. There was a palpable, again, abdominal organomegaly, and turns out this cat had a mast cell tumor infiltration in the large intestine. Here you can see the thickening of the intestinal wall. You can see enlargement of sternal lymph node, which was also confirmed to have mast cell tumor. The submandibular lymph node, popliteal lymph node was affected. So there were a lot of circulating mast cells in the blood. So really advanced case with many organs affected. Here we really didn't know what was the primary tumor. These cats clearly are not surgical candidates. A cat like this would be managed mainly with supportive treatment and possibly chemotherapy. Thank you very much for joining us. I hope you enjoyed it, and I'll happily take some questions. So the question is, can we use Stelfonta for mast cell tumors in cats? Thank you for that question. So Stelfonta, some of you might or might not be aware, is kind of recently found treatment for cutaneous non-metastatic mast cell tumor in dogs. It has not been licensed for use in cats, and I'm not aware of any anecdotal use in cats at present. Are there any other questions?
Not at the moment, it seems, but there may be more down the line. And if there are, please feel free to reach out to us. I just wanted to thank Kasia again for that. That was really informative and very interesting. And I hope it was for everyone who's attended. I hope you really found this session useful. The recording of today's webinar will be available on our website and on YouTube very shortly, along with all of the other 12-minute take-homes. Remember, this is the final in our series, but you should be able to find them all on YouTube. Finally, don't forget to download the app again and gain quick access to the VetCT's team of specialists. We have the screen up. Actually, I think it's the next one, Kasia, for a few seconds. So if you have time to scan the QR code, you can use that to get to, I think the last one might have it. You can use that QR code to get to the app if you'd like to download it. If you have any questions, just email us directly at sales@vetct.com. And again, just thank you. Hope you have a great day and rest of your week, and we'll see you soon. Take care.
Thank you, everyone. Bye.
Thanks, Kasia.